As a child, I've always been interested in science. Becoming a doctor would allow me to apply my scientific knowledge to help people improve their health and hopefully relieve their suffering. During my undergraduate training, I was fascinated by the complex ways in which our body functions. In particular, endocrinology captivated my interest. It is the study of hormones and how they coordinate different body functions. The first few years of the medical course required a lot of rote learning. Medical examinations were also tough and intimidating. One of the early challenges I faced was coping with death. It was not easy to witness the death of a patient for the first time. It is even more difficult if we have known the patient. I joined Raffles Hospital as its first full-time endocrinologist in 2006. I thoroughly enjoy my work here as I have the opportunity to work with a team of dedicated doctors, nurses, and healthcare managers. Working in a well-managed hospital, I can provide my patients with very efficient care. We can assess our patients and diagnose and treat the medical condition promptly. There is also greater continuity of care because I manage the patient myself from presentation to discharge. I enjoy spending time with my patients. This way, I can understand their condition better and provide them with personalized care. That said, medical practice in Raffles is never about one doctor. When I face difficulties diagnosing and treating patients, my colleagues would brainstorm together with me and solve the medical conundrum as a team. I start my day at the ward seeing hospitalized patients. After that, I would run outpatient clinic. Lunchtime is an opportunity for me to review my inpatients and admit patients who need hospital care. At the end of the day, I would check on my inpatients again to ensure they are clinically stable. When my patients feel better after treatment, I'm inspired to do more to provide quality care. Once I had a patient with diabetes who came to us for a second opinion. He was advised to amputate his foot due to a severe foot infection. I explained to him that we could only try to save his foot as he presented to us very late. After controlling his diabetes and with antibiotic therapy, his foot infection recovered and amputation was avoided. After that experience, the patient took good care of his diabetes. That event happened a decade ago and he is now still following up regularly with me. Unfortunately, there are many others who disregard our advice and neglect their health, as they are unaware that diabetes can lead to serious complications. Many of these complications can be avoided if their diabetes is better controlled. More can be done to increase the awareness of the dangers of diabetes. As such, I spend time explaining to patients about the importance of controlling their conditions. Over the years, I've learned to listen to my patients. They teach us much more than all the textbooks out there. If I can live my life all over again, I would still choose to be a doctor because I thoroughly enjoy being one. I'm an endocrinologist. I touch lives. What about you?